Hello everyone, my name is Rudy Serrano. I represent Care One Hospice as the Community Outreach and Education Manager. Thank you so much for being part of our third part of our series today in response to COVID-19. Today we're going to be discussing spirituality with three of our wonderful guests. Our first guest that's going to be sitting with us is Chaplain Eric, followed by our MSW, Melanie Margolis, and in closing with our clinical supervisor, Emily Burke. Thank you so much again for being part of this wonderful series with us. Enjoy. So, Rabbi Eric, what we want to discuss really is spirituality and the component of how it is affecting us as a community organization and basically our families.
Actually, the dialogue between myself and the families is as open now as it ever was. Families are looking for guidance and support during these hard times.
When we say incorporating spirituality in what you do in building trust, how are you going about that?
Well, actually, spirituality and building trust run hand in hand. It's inherent in the title and the position.
Right.
So when people finally recognize and understand what a chaplain is in relationship to other titles, the comfort level is there. It just happens, and then they start to just talk, and you'll find, and I find particularly, that people just tend to talk about everything, and you can do a full life review in spirituality and nurture and develop a relationship with them, and they're quite willing to do so.
Wonderful. So Melanie, our audience really wants to know what this means to you and the importance of it during your role during this time right now.
Yes, thank you, Rudy. Hi, everybody. So as a hospice social worker, certainly meaningful connections to me are most important in order to enhance one's emotional and spiritual well-being.
Are you recommending to families, some sort of meditation? What are things that we can encourage our audience, and our families to do during this time?
Absolutely. Thanks, Rudy. Definitely. So in these conversations, I am trying to reframe their thoughts and to remind them of their strengths and resources, which do include absolutely meditation, prayer. We have to remember our strengths. And in that, too, for me personally, it's about service. Another way I just helped somebody, which felt really good. I had a patient who recently had a birthday. I surprised her. I took her flowers and a balloon and just saw her through the window and did like this little visit through the window, and she was beyond happy and so grateful, and that felt really good. Absolutely.
Wonderful.
Yeah.
Thank you so much. So Emily, when we talk about spirituality, how does even the term spirituality come to mind to you? What comes to mind as far as you as an individual and how it affects your role in being a supervisor overseeing our nursing team?
Well, for me, spirituality has a lot to do with, having daily gratitude, having, keeping your mind clear. It's not always, doesn't have to be a religious thing in my world. To me, it's really more showing gratitude,
Right.
remembering what you're grateful for.
So how do we incorporate that with our nursing teams?
Well, there's a lot of things that we do here at Care One and that I do individually. Before meetings with the nurses, we really make sure that we let them know how grateful we are to them. In Buddhism, they call it the Sangha. And that's your community, and making sure that your community is tight knit and you stay together. So for us, my nurses are like my little sangha, and I just make sure that we all stick together. We encourage each other, we uplift each other, and if there's anyone having a hard time, we all bond together. And that's what spirituality is all about. It really is.
Well, thank you so much. And in closing, I want to acknowledge and pinpoint again on what you were talking about is we are all in this together. None of us are alone. And I want to encourage you as an audience. If you are feeling that way, please reach out to us. Reach out to a loved one. Reach out to a neighbor. Just contact somebody. Because we are on this together and we are going to beat this together. So thank you so much for being here, Emily. I really appreciate you. Folks, have a wonderful rest of your day. Thanks for being part of this team. Thank you.